Welcome back to Medicas video podcast. Ladies and gentlemen, my name is Varun. I hope you're all doing well. Thank you for appreciating as well as liking and subscribing to our channel. We all are very happy that you have been appreciating the video podcasts that we are doing around the health care ecosystem, which are catering to the common causes of various different ailments from the top doctors available across the world. So we have Dr. Sujeet Kumar again with us today. He's, as you all know, he's a nephrologist with 14 years of experience from Wisconsin, United States. Welcome back, Dr. Sujeet. Thank you so much, sir, for joining in once again with us.
Thanks, Varun. Thanks for having me.
Appreciate it. So, Dr. Sujeet, as well as the audience, the important topic we want to discuss today is the kidney transplant, right? So, we will start off with asking with some common questions about the kidney transplantation. And we have divided this conversation into different sections. So, all of you will understand very clearly about this kidney transplantation and make sure that you are thorough in terms of this subject. But then again, this information is not limited. This is exhaustive. There are a lot tons of information which is authentic information provided by the government resources available online. We recommend you to go through that as well, belonging to whichever country you are from. So, Dr. Sujit, the first section we would like to discuss is who would be the right candidate for the kidney transplant. This is the subject or section that we would like to first go with it, Dr. Sujit. So, in that, what are the criteria for needing a kidney transplant?
Okay, so to need a kidney transplant, you have to have kidney failure. Okay,
Okay.
and either you are on dialysis, which is a machine used to clean the kidney, body when your kidneys are not working, or your kidney function is less than 15% and you're approaching dialysis. So either of those two conditions need to be met to get a kidney transplantation.
Oh, okay. Got it. Of course, I mean, whenever your kidney fails is when you would need another one, obviously. So the
Right.
another important information, what you said is if your kidney functionality is less than 15% or you're nearing to the dialysis stage, you will then be qualified for kidney transplantation.
That is correct.
Oh, okay. So are there any age restrictions for a transplant recipient, sir, to ask in a simple language, in order for a person to receive a kidney, is there any age restriction?
Okay. So to qualify, as I said, those were the two minimum criteria. And then starts the tough process. Uh, so if you really say, is there any age limit? The answer is no.
Okay.
Okay. But the key goal is you have to be in a healthy condition to get a kidney transplant.
Uh-huh.
And you can get a kidney transplant at 75, and you may get rejected for a kidney transplant at 50 if you are not healthy enough. By that,
Oh,
it could mean if you have a serious heart disease, if you have a serious cancer, and if you're doing things which disqualify you, like drug use, alcohol use, and those things. So age is not a strict criteria. You can get qualified at a higher age and you can get disqualified at a younger age.
right. So the vice versa also, Dr. Sujit. Is there any age restriction to donate a kidney?
So again, there is no age restriction,
Okay.
but I mean, after you're approaching 65 and 70, it'll be very tough to find a healthy kidney which is normal, which can be transplanted into the recipient. Now, to donate a kidney, the person has to be in a perfectly good condition and has to have a normal functioning kidney, both of them. So, if there is any problem with his health condition, high blood pressure, diabetes, then he doesn't qualify.
Great, great, wonderful. So, ladies and gentlemen, this is what we would like to understand about who is a candidate for a kidney transplant. So, these are some very important and common questions that are being asked. We'll move on to the next section, Dr. Sujit, about the transplant process. So, in various countries, I mean, the wait list for a kidney transplant will be different. So, in your experience and in your circle, based on the knowledge that you have acquired, what is the wait list that we have been seeing in different countries for a donor for the kidney transplant, Dr. Sujit?
Okay. So the scarcity of organs is immense, both in United States and in India. So, for example, in United States, about 600,000 people are on dialysis, and only about 25,000 people get a kidney transplant. So you can see the discrepancy. And similarly, in India, about 2 lakh people are on dialysis, and only about 15,000 get a kidney transplant. So you can imagine the scarcity of the organs, where there's a big need, but there's not much availability. So because of that, there is a big wait time. Now, it's important to understand, if you have a living donor, there is no wait time. Once you're on the list and a living donor can donate, you can go ahead with the transplantation. The wait time is only if you're getting a kidney from somebody who has died and donated after his death.
Right. I was about to ask you that question, Dr. Sujit. What are the different options for finding a kidney donor living or, a person passed away?
Okay. So every country has their own system. India and United States, they both have their system called diseased donor organ transplantation, where somebody who dies in an accident or some other condition, and the family decides to be a donor, and for that the patient has to be either brain dead, or there's called a condition called donation after cardiac death, where you retrieve organs from the deceased person, and then that can be used to transplant in people who need a kidney transplant.
Oh, okay, okay, got it. Glad. So, Dr. Sujit, so once, let's say, the donor has been found, as well as there is a recipient available, just on the papers I'm talking about. What are the steps that are involved in the evaluation process of both the recipients as well as the donor,
Ye-
medically and non-medically?
Correct. So medically, let's start with the recipient. The first step is always the recipient has to be in a medical condition ready to accept, meaning he should not have a bad heart disease. There should be no evidence of cancer, and he should be able to afford the medication after kidney transplantation, which are expensive. And there should be good support system to support during and after the kidney transplant process. And they should also undergo a psychological evaluation. The same things applies to donor. The donor has to be psychologically evaluated. They should be made sure that they don't have diabetes, which is affecting the kidney, and both their kidneys are in perfect condition. Only then they would be able to donate. So, there's a lot of rigorous screening process involved, but the step one is always that the recipient has to be medically fit and surgically fit to undergo the transplantation process.
Great, wonderful. Dr. Sujit, this is again a very a common sense question which just struck my mind. So you just mentioned that let's say all the qualification parameters are met, but I'm not sure if this is a qualification parameter. But then again, let's say if there are any chronic illnesses, like it could be diabetes or thyroid, or it could be a heart disease kind of stuff for a donor, and but the kidney is still healthy, and if the donor donates that kidney living or post passing away to a recipient, are these chronic illnesses going to be carried on to the recipient also?
Okay, so no, diabetes, high blood pressure, and those things, they don't get transmitted to the recipient, because
Okay.
those are diseases which are in the system but not in the kidney. But
Okay.
there are certain diseases, like if you have infection like hepatitis B or C, or other conditions, that can get transmitted to the recipient. So they have to be screened for infection diseases. But diabetes and hypertension, they do not get transmitted to the recipient.
Okay, wonderful, great. That's a great clarification, Dr. Sujit. Now we have spoken about the evaluation process. How is the donor right match to a recipient and vice versa? And let's say everything, the kidney transplantation is done, and we'll now talk about the post-transplant care and the risks. So what medications will a recipient need after the transplantation is done in order to prevent any rejections?
Yes. So there are generally three medications which are called immunosuppressive medications. So they lower your immunity so that you don't reject the kidney. And generally, the medications are, one of them is a steroid, the other one is called tacrolimus, and the third one is called mycophenolate. So generally, a triple combination of immunosuppressive medication to prevent rejection.
Okay. Sir, when you actually suppress the immunity of a person, what are the side effects a kidney transplanted person or recipient or a patient has to be aware of, when they take these anti-rejection medicines,
Yeah, yeah, yeah. Great question. So they are prone to infections, as you can imagine, because their immunity is being lowered. So that's the number one concern. Number two, the we mentioned use of steroids or prednisone, and that can lead to diabetes, which can affect the kidney, and that can lead to weak bones, that can lead to cataract, and that can lead to other chronic conditions. So steroids are a big risk factor for this condition, and people are more prone to diabetes after taking anti-rejection medication. So a host of risk factors are associated with use of these medications.
Okay, okay. So then I think all those who have got the kidney transplanted ensure that they always are under the supervision of a doctor to make sure that they don't find the signs and symptoms of the kidney transplant rejection. But Dr. Sujit, what are the symptoms and signs of kidney rejection after the transplantation?
So yeah, it's important to understand that there is no clear sign or symptom of rejection. Generally, to find a rejection, you monitor their blood tests, and if you see that the kidney numbers are declining, then what you do is called a biopsy of the kidney, and then the biopsy finds the rejection, and then you treat it. So you have to monitor by blood test rather than wait for symptoms to occur.
Otherwise, there are no physical symptoms like like a sneeze or maybe eyes turning yellow kind of stuff, or
Uh,
maybe no urine coming out. Okay,
well,
okay.
yeah, I mean, no urine coming out definitely is a concern, but generally it doesn't mean that your body is getting rejected,
Okay, okay.
rejecting the kidney. Correct.
Glad, wonderful. Now, these questions, the other questions that I'm now going to ask you are more related to lifestyle, Dr. Sujit. I'm sure our audience will also be having these questions in their mind. After the transplantation is done, can they travel?
Oh yes, yes, yeah. They can travel anywhere in the world. There is no restriction of travel. They have to make sure that they have their medications intact, and they have to use as all general precautions which normal visitors use.
Okay. How about visiting a doctor on a regular basis? Should they continue to visit the doctors regularly after the transplantation?
Absolutely, they have to be monitored very closely, typically every month by the transplant doctors, especially their blood tests, looking for their kidney function, and other tests to make sure there is no side effects of the medications they are being used to prevent rejection.
Okay, okay. Sir, you did mention in one of the explanations that the medication as well as this process of the kidney transplantation is a little on the expensive side, both for the donor as well as for the recipient. Now, are there any financial resources available in order to help these transplantation costs in various countries?
Okay, so generally in United States, it is covered by insurance,
Okay.
and in India, of course, the situation may be very different. There are private companies giving insurance, but I think most of the transplants in India are private pay, and generally it costs more than 5 to 10 lakh rupees.
Okay, okay. But then again, there are financial resources available, and it's always recommended to take an insurance for these kinds of, not for this, but it's always better to take an insurance that also covers these kinds of unexpected situations. Okay, great. So, what are some ethical, considerations for the kidney transplantation, sir, like living donation, organ allocation, etc.?
Okay, so yeah, living donation is a complicated business. Uh, in USA, I can tell you that There is a robust system of screening where anybody can donate a kidney to any other person. You don't have to be a relative or a family member. You can be a friend. You can be a completely unknown person to donate a kidney. But every country has their own system, and the bylaws of that country has to be followed in getting a kidney donation done.
I agree, sir. Absolutely. In India, I think there are some rules that are laid by the government of India, and it's very clearly set up on the government of India's website, also related to kidney transplantation. Ladies and gentlemen, we have now discovered and uncovered a lot of truths around the kidney transplantation. Who is the right match? How do we identify if that person is a right match or no? The evaluation process, the transplantation process, post transplantation care, as well as some common questions that most of us have. I hope this video and this discussion with Dr. Sujeet Kumar has been very helpful to each one of you. Dr. Sujeet Kumar, thank you once again for opening our eyes, especially for our audience as well as to a lot of us regarding the kidney transplantation and bursting a lot of myths as well. So, most importantly, all the doctors say prevention is better than cure. So let us not fall prey to these kinds of heavy surgeries or organ-related diseases which may require transplantations. So in the previous videos, Dr. Sujeet Kumar very clearly discussed how much water we should take, what are some healthy practices we should follow for maintaining a very good kidney health. So please follow them. We'll also give you the link of those videos in our description. So please ensure that you all take a very good care of not only kidneys but also your overall health. Thank you so much, Dr. Kumar, once again, sir. We will again reach out to you for another important topic.
Thank you, Warren. Really appreciate it. Thank you.
Thank you, sir. Namaste, everyone.
Namaste. Bye.